Hello, good evening, everyone. My name is Mr. Allen. So, welcome again to our Facebook Live on nursing prioritization and delegation this week. So, my name is Mr. Allen again, Alan Matus, and I'm a nurse educator. I've been teaching nurses for almost 25 years. And also, if you don't know everybody, I'm also an author of a book. So, let me pull that out a little bit. See. Okay, so this is my book in Amazon, everyone. As you all know, I'm an author of a book which is titled Simple, Fast, and Easy NCLEX Review. And you can purchase this in Amazon, and also it's available in the Philippines also. So if you want to purchase in the Philippines, you can just let us know. You can email Matus Nursing Review Academy at gmail.com. Okay. All right, so everybody, are you ready for our Facebook Live for tonight? Because I have prepared you several questions that hopefully you will be having a great time learning, especially the principles on delegation and also your prioritization, everybody. Okay, now, one thing to remember again as well, everyone, is that in 2023, you're going to have the implementation of the phase of the NCLEX next generation format. So I have done recently a workshop on the different item formats that they will be asking in the NCLEX examination. The formats that will be included in the NCLEX next gen. Okay, and that will be in April 2023. Everyone, that's going to be next year. Now, before anything else, also I would like to give a shout out to our participants who came in here very early tonight. So very early for tonight, we have the following people, guys. So I would like to give a shout out to Chimika Jones. So Chimika is one of our students. She's from Canada. Also, Jerwin Cedillo Katubig. So Jerwin, I guess you already passed your NCLEX. I'm not really very sure, but I think you did. Teresa Carvajal, Ramraj, Garima Srivastab, um, Chari Jaila or Jila, Arakshan Martir Shanta Florville also. Okay, and also Elizabeth Dyke. So thank you very much for being here tonight, everyone. Um, I have prepared several questions for you. We'll be focusing on one topic for tonight. I'm not going to tell you what the topic is, but this is a topic that you will really enjoy for tonight, everybody. So now let's go to another one. Okay. All right. So the next one is I want to share first a testimonial because we would like to inspire you to study very hard for your NCLEX examination. So let's have a testimonial from Joe, who is one of our pastors last May actually, but I would like to share this very special testimonial from him. Um, he says, I'm from the Philippines and I graduated last 2011 and I haven't been practicing my nursing career since then. Last year, I decided to take up NCLEX RN and was referred to Sir Alan by my wife. Being in his class always inspired me to be better, and it felt like I'm not in a class but inside a motivational talk. These basic fundamentals helped me understand challenging questions, and Sir Alan's delegation skills was really helpful to me. I'm an international student. I attend his classes live on a different time zone. It was a challenge to stay awake, but with his motivation and a sense of humor, it helped me pull through the night. To all his students, never give up on your dreams to become an RN and stay driven. Sir Alan, it was the right decision without a doubt to be one of your students. Okay. As you all know, everybody, I have also been a nursing faculty for so many years, and I really like helping students, especially guiding them through and realizing their dreams. So nothing makes me much happier than seeing the students succeed and really pass their NCLEX examination. Okay, so another one, we have our motivational photo of the week. Our motivational photo of the week was sent to us by one student, and of course, what you can see in the picture will be the workbook, and then the online NCLEX Academy when I'm doing the lecture. So the student is studying in the coffee shop, I guess, like me, Because if there's one thing you need to know about me, guys, is that I really like studying in a coffee shop. So I always stay in a coffee shop. I like drinking coffee, and at the same time, it's much easier for me to study in the coffee shop. However, for students, you always have to remember that you have to find out what will be the best location for you to study. So some students, they like studying at home. Some students, they like to study in the library, for example, or some students, they like to study in a coffee shop or any place. So you really have to find that spot wherein you will be very productive in studying. But for me, to be honest with you, I'm always in a coffee shop. Okay, I could spend there several hours just to finish my work and also to study at the same time. Okay, so another one. Of course, for tonight, we're gonna have your free 90-day online access NCLEX review. So we're going to pull out the winner at the end of this show. So let's find out who's gonna be the lucky person to win the free 90-day online access NCLEX review. And if ever you win the 90-day online access NCLEX review, you may also have the option to get the NCLEX Success Workbook, which is a workbook that a lot of students really like. So for those who has my workbook right now, can you please do a shout out in the comment section and let everybody know how the workbook has helped you so far. Okay. All right. So now, everybody, if you haven't done it yet, can you please share or click subscribe? If you're watching on YouTube, please click like. It's all for the algorithm. And also share, guys, right now to your classmates or to your friends so that they can also benefit from this program, everyone. Especially with your delegation and prioritization, which is a big chunk of your test plan. It's a big percentage of your NCLEX test plan, your delegation, and then your prioritization. I always have a lot of students always going back to me and saying that the videos that we have in YouTube, Facebook Live really help them in their NCLEX review, especially the prioritization. So I really feel very happy that these videos are helping out students, not only new graduates, but also students who graduated for so many years. They suddenly have this light bulb that when they listen to the explanations in YouTube, they're like, oh, yeah, I think I can do this. So guys, please share with other classmates so that they can benefit also from this program. Okay, especially dissecting and really explaining the rationals for the simple questions that we have for tonight. Now, it's not all about answering thousands of questions only. The most important thing is to really know the principles behind answering questions so that whatever kind of questions you will receive in the NCLEX, you'll be able to answer it because you know the principles behind them. And if you watch all of my videos in YouTube, then slowly you will get the principles or the major concepts behind these questions. Now, before we proceed, also I would like to just kind of like give a shout out to some people here who's giving some great feedback. So Vibrant was a winner of our 90-day online NCLEX review, and she actually passed the NCLEX already. So she passed her NCLEX last year. She won the 90-day online NCLEX review, and she says that she loves the nursing, prioritization, and delegation. Such a big help. And she is a repeat test taker also. So I think this is the biggest help of the program, the prioritization, and then also the delegation. Okay. All right. So let's proceed. Okay, so let's proceed now to our first question for tonight. So everybody, are you ready for our first question for tonight? Okay, so we have prepared you delegation questions and then prioritization questions. So the same thing I'm going to be presenting for patients, and then you have to choose which patient is the most unstable and then is your priority. Okay. I will be including some of these questions in the next book that I will be publishing by next year. So I'm publishing a book on NCLEX prioritization and delegation, and also there is a plan to put that also into an application. So I have created more than 300 questions for prioritization and delegation. So guys, if you're excited about that, can you please put a comment in the comment section if you're excited about having an application for prioritization and delegation questions, everybody. Okay? All right. Now for the NCLEX Next Gen, you will still be having some questions on prioritization and delegation, definitely. Okay, but we still don't know how it will, how prioritization delegation will be impacted by the changes in the NCLEX by next year. So we'll watch out for that, and that's why I'm publishing my book after the implementation of the NCLEX Next Gen, just to make sure that we have the latest updates. Okay, now let's proceed to our first question for tonight. Okay, so our first question is going to be about prioritization, having the usual 4 patients or 4 clients in the situation. So number 1, the nurse cares for 4 clients in the medical surgical unit. Which client should be seen immediately? A, the 42-year-old client on skeletal traction with elevated D-dimer result. B, the 50-year-old client whose legs are abducted after a total hip arthroplasty. C, the 65-year-old client who has gentle bubbling in the water seal system after chest tube insertion. Or letter D, the 39-year-old client with hypothyroidism who feels cold and asks for additional blankets. Okay, again, let's read the question. So the nurse cares for 4 clients in the medical surgical nursing unit. Which client should be seen immediately? A, the 42-year-old client on skeletal traction with elevated D-dimer result. B, the 50-year-old client whose legs are abducted after total hip arthroplasty. C, the 65-year-old client who has gentle bubbling in the water seal system after chest tube insertion. Or D, the 39-year-old client with hypothyroidism who feels cold and asks for additional blankets. Now, I would like you to give your rationale why you choose a certain letter in this situation. Why did you choose A, B, C, or D? What's the reason? Let us know, or let me know. What's your reason, guys? A little bit of intermission. I want to share this testimonial from Olubunmi Balofin. So Olubunmi is one of our students who passed the NCLEX. She passed the NCLEX last year. So thank you very much for dropping by, Olubunmi. Olubunmi, I'm really very happy that you're here tonight. Thank you very much. Nice to see you here. Okay, everyone, I'll give you a little bit more seconds to choose your answer for this question. Okay, so let's try to get the answers. Now, why do you think is A the answer? Okay. Now, for this question, some of you, one of the things that we need to remember here is that in the NCLEX, again, as what I have always said, all of these patients could be unstable, but you always have to choose the most unstable patient, the patient who is a priority. Now, the answer to this question, everyone, is going to be letter. Let's pick up the answer. Very good. So that would be letter A, everybody. So that would be your letter A. The 42-year-old client on skeletal traction with elevated D-dimer result. Now, why is letter A the answer? Letter A is the answer because when you have an elevated D-dimer, what is D-dimer again, everyone? What is D-dimer for? Okay. What is D-dimer? What lab is D-dimer? So D-dimer is a laboratory value that indicates if you have any clotting happening in the body. Okay, if you're forming clots in the body. So your letter A may indicate the presence of a DVT, especially your client is on skeletal traction. Now, what happens when you are on skeletal traction? Then of course that is correlated with bed rest, and bed rest can lead to the formation of blood clots. Am I right? So that's why letter A is the answer. Now your letter B, the 50-year-old client whose legs are abducted, well, that's expected. That's really something that we need to do after a hip surgery, right? In the NCLEX, you always have to remember that abduction is the number one thing that we have to do. You have to separate the legs of your patient after surgery in order to prevent hip dislocation. So that's why letter B is not the answer. Letter C, the 65-year-old client was gentle bubbling in the water seal system. Now, if you have chest tubes, everyone, it is expected that you will have, okay, that you will have, excuse me, guys. Okay, so it's expected that you will have gentle bubbling, because gentle bubbling indicates that water is being removed. Not water, but rather air is being removed from the chest cavity, and especially if your patient is having pneumothorax. So that's why letter C is okay. Gentle bubbling in the water still system. Letter D, the 39-year-old client with hypothyroidism who feels cold. Well, if you have hypothyroidism, it's expected that patients may be asking for additional blankets because usually they have hypothermia. So in this situation, guys, the answer is going to be letter A. Okay, and again, one of the principles of prioritization is that if the symptoms are part of the condition or expected, then it is not necessarily a priority because it's expected from the condition. Okay, anything that is not part of the disease process may indicate the presence of complication. And always remember your Maslow: airway, breathing, and circulation. Okay, very good. Now let's go to the number 2 question, everyone. Which client is at highest risk for developing deep vein thrombosis during hospitalization? Is it A, the 52-year-old client who smokes while taking oral contraceptives? B, the 45-year-old client with hypertension who likes to eat chips? C, the 24-year-old client with thick mucus secretions due to cystic fibrosis? Or letter D, the 59-year-old client with cramping leg pain due to Buerger's disease? Again, I will be reading the question. Which client is at highest risk for developing deep vein thrombosis during hospitalization? Is it A, the 52-year-old client who smokes while taking oral contraceptives? B, the 45-year-old client with hypertension who likes to eat chips? C, the 24-year-old client with thick mucus secretions due to cystic fibrosis? Or D, the 59-year-old client with cramping leg pain due to Buerger's disease? I guess most of you answered letter A. Let's see if that's really the answer, guys. Kind of like easy, huh? The answer, everyone, is going to be letter A. Very good. Okay, so those patients taking contraceptives are at high risk for thrombosis or deep vein thrombosis. Okay, now especially also those who smoke, because if you're smoking at the same time, you're gonna have your clot formation there. So the risk. Now, your letter B, hypertension, eating chips, that's not a risk factor for your thrombosis, really, because that's going to be more of hypertension and then elevated levels of sodium. Your letter C, thick mucus secretions are commonly found in patients with cystic fibrosis, but it does not really mean that you're going to have clot formation. Letter D, cramping leg pain due to Buerger's disease. Not really, because that's part of the condition and it's not really an indication of clot formation. Now, what are the risk factors for clots to form? Always remember, in the NCLEX, you have your Virchow's triad. Now, what are the 3 components of the Virchow's triad? Anybody in the chat box or in the comment section? The 3 components of your Virchow's triad. That would be your venostasis, vein injury, and viscosity of the blood. So if you have slow circulation or stagnant circulation, or another one is vein injury, okay, or blood vessel injury like surgery, for example. Or last one, if you're dehydrated, when you have increased viscosity of the blood, that is another a risk factor for the development of deep vein thrombosis. Now, remember also, everybody, that there's two types of thrombosis. You have your superficial thrombophlebitis, and then you have your deep vein thrombosis. Now, both ways, when you say thrombophlebitis, it means that you have the clot and then followed by inflammation. So there's superficial, and then there's also what you call deep vein thrombosis. Deep vein thrombosis is the one that forms in your deep veins, and deep vein thrombosis is more likely to lead to pulmonary embolism because the clot from your legs may travel into your heart and then into your pulmonary system, causing you pulmonary embolism. So you call that your deep vein thrombosis, everyone. Okay? Just remember that. And remember that in the NCLEX, DVT will be there. Okay? All right, next question. Are you ready for your SATA? Okay, SATA. Okay, so we have very good Ram Raj. He said that one of the virtues tried is endothelial damage, hypercoagulation. Very good. Okay, you know your virtuous triad. Now let's go to number 3. Select all that apply. The nurse is conducting education on how to prevent deep vein thrombosis among clients in the unit. Which interventions will be included in the teaching plan? Select all that apply. So the focus for tonight's lecture is really all about DVT. It's all about DVT. So let's go to the interventions. There A, apply elastic stockings. B, encourage ambulation. C, place a pillow under the knee. D, apply pneumatic compression device. E, provide adequate hydration. Or F, administer low molecular weight heparin. I will repeat the question. The nurse is conducting education on how to prevent deep vein thrombosis among clients in the unit. Which intervention will be included in the teaching plan? Select all that apply. A, apply elastic stockings. B, encourage ambulation. C, place a pillow under the knee. D, apply pneumatic compression device. Letter E, provide adequate hydration. And letter F, administer low molecular weight heparin. Okay, so what's your answer, everyone? Select all that apply. Always remember that in the NCLEX, it's possible that you only have one answer. Or it's possible also in the NCLEX that you have everything will be the answer. So currently in the NCLEX, that's how it works. But in the NCLEX Next Gen, it might be a different story, the way you're going to be scored. Okay, so the answer for this question, everyone, is going to be, it seems like most of you have the same answers in the chat box. Let's see. Okay, so the answer, everyone, for this question is going to be, all right, so that would be letter A, B, C, and F. Very good. So most of you got that right, guys. Apply elastic stockings, of course, to prevent DVT. We apply compression stockings or elastic stockings. Letter B, encourage ambulation. Letter D, apply a pneumatic compression device. A pneumatic compression device is a device that constantly provides pressure into the lower extremities to facilitate circulation. Letter E, fluids. And letter F, that would be giving your low molecular weight heparin. Okay, very good. Except your letter C, because you're not supposed to flex the knee of your patient, when they're on bed rest. And also one way to prevent deep vein thrombosis is also to perform exercises while the client is on bed. Okay? All right, very good, guys. Now let's go to, before anything else, I would just like to plug in our next schedule for the live webinar. So we have a 10-day live comprehensive NCLEX review. That's going to be either a classroom or webinar. So you can join the classroom lecture via webinar or virtual. So this is a blended learning course that combines live lectures and online assignments. So meaning to say that you're going to have topics in the classroom and some topics in the online as well, the self-study. So that's going to be October 15 to December 17, 2022. It's going to be every Saturday from 9 to 4 p.m. Pacific Time, Cypress, California. Okay? So just visit our website if you have any questions, guys. And another one, of course, your self-study program. We have a lot of self-study program in the NCLEX Academy. So we have for RN, for PN, and also we have specific for the Philippines. So if you're from the Philippines, you can also enroll in the self-study program as well. Now, so our NCLEX Academy, you have interactive core content review, highly organized and up-to-date task plan-based curriculum. I really make sure of that. NCLEX Success Workbook that comes with the review program, study plan schedule, hundreds of end of lessons NCLEX quizzes, final NCLEX predictor assessment exam, and our Facebook live recordings and discussion groups as well. So it's a one-stop shop, all information and resources that you need to pass your NCLEX exam, everybody. Okay? And of course, when my students enroll in the program and they order the workbook in the United States, at this time, we have a promo. So whenever you buy the workbook, it comes in a very nice box. So that's our promo right now. It comes in a nice box and bookmarks and all the other materials. So for those who have this already, can you put a shout out in the comment section? Okay, how you like the boxes? Okay. Okay, so now we're gonna have your number 4 question, everyone. Okay, so number 4. Okay, we're going to put the pricing in the comment section. Okay, or you can visit our website on the screen right now. It's www.matusnursingReview.com and click online NCLEX review. So number 4, NCLEX challenge question. A client on skeletal traction suddenly develops severe sharp stabbing pain, chest pain, and hemoptysis. What is the first action that the nurse should take? A. Call the registered nurse. B. Administer oxygen via face mask. C. Elevate the legs. D. Inject heparin subcutaneously. Or D. Assess for Homan sign. Okay, so let's go over the question again. A client on skeletal traction suddenly develops severe sharp stabbing chest pain and hemoptysis. What is the first action that the nurse should take? A. Call the registered nurse. B. Administer oxygen via face mask. C. Elevate the legs. D. Inject heparin subcutaneously. Or E. Assess for Homan sign. Okay, so what do you think will be the answer, guys? Okay, so if you want to know the pricing for the different programs that we have, you can visit our website. Everything is there in our website, especially all the information that you need. And really the good thing about the NCLEX review that we offer is the fact that it comes with a workbook. And the workbook, guys, is 400 pages. And our curriculum is really from fundamentals to med-surg up to mental health. And I'm the one teaching everything. So as a faculty in the nursing program, I teach students all subjects in the nursing program. So I'm bringing that to you as well. And it comes with a workbook. And anyone in the comment section, you can also give a shout out if that's something that you like the NCLEX Success Workbook. Okay, now what do you think is the most important intervention for someone having this condition? Now, so let's take it out. Okay, all right. So the answer, everyone, is going to be letter B. You have to administer oxygen via face mask. So the first one is really, it's not a select all that apply question, but the first thing that you have to do is to really give oxygen because this patient is having chest pain and also hemoptysis, which are indications of pulmonary embolism. So remember, this patient is on skeletal traction and patient is immobilized or on bed rest. So stabbing chest pain is a sign of pulmonary embolism. So the first thing that we have to do is to give your patient oxygen via face mask. Okay, oxygen via face mask, everyone. Now you're assessing for Homan sign. Always remember the one thing that I told you before, guys, that If your patient is in distress, having problems with airway, breathing, or circulation, or any emergency, the first thing you have to do is to intervene first. Assessment can be done afterwards, but then the first thing is you have to do something first, safety of your patient before you further assess your patient. If you don't have the full information and your patient, for example, is not really in distress, then you can do assessment. However, in this situation, your patient is in distress. So you really have to what? You really have to give oxygen first because chest pain and hemoptysis. Okay? So oxygenation is the priority in this question. Everybody, are you ready for our last question for tonight? Okay. So far, are you enjoying the question so far, guys? It's going to be a very quick session only, but if you go back to all of the sessions that we have, this is session 69, I guess. So go to YouTube and watch all of our videos, or here in Facebook Live also, okay? And watch all the videos that we have. And of course, before the end of this program, maybe, you will win the 90-day free NCLEX review. So let's go to the last question for tonight. Okay, so this is all about delegation. So which task should be delegated to a new graduate registered nurse working in the cardiac unit? A. Observe a newly admitted client for sinus tachycardia. B. Provide intravenous hydration to a client with diarrhea. C. Assess the client after returning from catheter ablation procedure. D. Administer blood transfusion to a client in sickle cell crisis. Okay, let's read the question again. Which task should be delegated to a new graduate registered nurse working in the cardiac unit? A. Observe a newly admitted client for sinus tachycardia. B. Provide intravenous hydration to a client with diarrhea. C. Assess a client after returning from catheter ablation procedure. Or D. Administer blood transfusion to a client in sickle cell crisis. What do you think is the priority here? Okay, so the answer to this question, let me see the others. Always remember, this is a new graduate registered nurse. So this is a question for those taking the NCLEX RN. Okay, for those taking the NCLEX RN. So which one could be delegated to a new graduate registered nurse? Final answer, Chumika, you got it? Okay. What about Marianne? Okay. Chantal, you also have your final answer. So shout out to Galina Nikitenko, Jan Dadiligaw, okay, Nanea Makatangay, Sangita Yadav, Maureen Feliciano. Can you please tell me, everybody, from which country are you calling from, or are you joining the class from? Where's your place, everyone? Can you tell me very quickly before I give the final answer? Okay, let's see where you're coming from, guys. Are you all from the United States or from other countries? From California, Cecilia is from California. Okay, very nice. Okay, so we have somebody from the Philippines. Okay, Josephine Mary Onu. Okay, Chantal is from Florida. Okay, and then we have Maureen is from, Feliciano is from California. Araxia Martirosian is California. August, one of our students in the academy right now, is from the Polo, Mindanao, Philippines. Sangita Yadav. Okay, very nice to see you guys. Okay, so all of this will be posted in YouTube. Now, the question is, are you all ready for our final answer for this delegation question, guys? Ready? So, the final answer is going to be, or the correct answer is letter B. Very good. Most of you got the right answer. So the task that could be delegated to a new graduate nurse will be you're providing intravenous hydration. Although letter B is unstable, probably because of the diarrhea, however, for a new graduate nurse, that is a task that is that is the most simple task that at least the graduate can do, the new graduate RN can do. Intravenous hydration is a simple skill. Now, why are the other options not correct? Your letter A is not correct because of the keyword newly admitted. And we say that newly admitted patients are usually unstable. Okay? Newly admitted patients. Okay, so that's number one, letter A is not the answer. Now, your letter C, assess a client after returning from catheter ablation. No, 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 no. Assessment is not something that we delegate. Okay, especially if it's a procedure that's catheter ablation. Because the question is catheter ablation an invasive procedure? Of course it is. So that's why letter C is not going to be delegated. Now, letter D, blood transfusion. Yes, the new graduate can do blood transfusion. However, the key word in letter D is sickle cell crisis. Okay? The word sickle cell crisis makes letter D unstable. So that's why the closest is going to be letter B. That's something that you can delegate to the new graduate registered nurse. Okay? All right, everybody. I hope you enjoyed our presentation for tonight. I will see you again probably next week. I'm having a great time, guys. You can also visit our website and click on our merchandise products. So we have masks, we have motivational sweatshirts, motivational bottles also. And again, guys, thank you very much for being here tonight. Thank you so much. Leave a note in the comment section. And then again, don't forget to share this with your friends, everybody. And next week, we'll have more exciting questions for next week. I'm going to make sure we're going to have great questions next week. It's going to be at least 5 or 6 questions, everyone. Thank you very much, everybody, and have a great, great night.